Hello and welcome. Welcome again. This is Dr. Valerie Mukanga with Healing Wings Dental, the place where we help people regain or maintain their oral health so that they can soar better in life. So, today what I want to talk to you about is what are some things that causes your teeth to be misaligned. So, this is a question. I was somewhere yesterday, and someone asked me, so Dr. Valerie, why do some people have, teeth that are not well in position? What are some of the things that causes those issues to occur? And I gave some information to the person, but I thought, oh, if that person had the question, then maybe many other people may actually have the same question. So why not just answer it on a video? So this is what we're going to be doing today. So what are some of the things that can cause your teeth to be misaligned? The question was, is it something that is hereditary, or is there some things that you are doing that can cause your teeth to not be well aligned? So yes, so there are some people with whom, misalignment of teeth can be hereditary. For example, when I'm going to talk about misalignment, I'm going to talk about diastema, which is a fancy term for just the spaces that you have between your teeth. And that may or may not be a problem for some people, depending on how you feel, as far as like having a space between your two front teeth or some other type of spaces between your teeth. But that can be hereditary. And another thing that can cause you to have teeth that are not well aligned could be that you have a small mouth. So your teeth are kind of like bigger and your mouth is small. That creates like a problem for teeth to actually erupt in the proper position. So your teeth are going to erupt wherever they see fit. So that can be something else that can cause, your teeth to be misaligned. There's one thing that can also cause your teeth and your mouth to actually, the palate to actually assume another position, and your teeth to end up not being in well aligned. And that you see when you in children or in people who suck their thumb or some other fingers. You can see that problem where you would notice that their teeth are not well, they're not straight, but they can kind of like shift or kind of flare up. And in that situation, when a child suck their thumb for too long, then they can start having like the teeth start assuming another position. Your palate start narrowing a little bit more, and that creates some issues later on in life. So the person was asking me, so does that mean that the child cannot suck their thumb? Well, we recommend that after about 2 years of age or so, they start, you start refraining your children from sucking their thumb. And that goes also with the use of pacifier. So I know, that many times we're so busy and we need to keep the child, occupied. And, even from when they're born, there's the pacifier that are introduced to them that helps them, as far as sleeping better, or like kind of like, relieving themselves from stress and things like that. Yes, that's okay. But, there come a point where you definitely want to refrain them and retain them from, using the pacifier too long. And it's the same rule of thumb. It's about 2 years old or so. You want to start removing the use of pacifier, because it can create the same thing as with children who are sucking their thumb, where it start, creating or pushing your teeth and causing you to start having those kind of issues where your smile is no longer straight, but it's assuming like kind of like a curve like around your teeth, or your teeth flaring. There's also tongue thrusting. So some children, they don't actually suck on their tongue or even use a pacifier, but they keep thrusting their tongue. So they are sucking on their tongue or thrusting their tongue, meaning that they're pushing their tongue forward and backward. And that can also cause those kind of issues. So So those are some of the things that can cause, misalignment of teeth. However, as even adults and children also, when children lose their teeth too early, maybe due to cavity or some infection that causes the teeth to be lost too early, especially when it comes to the back teeth, what happens is, if they don't actually go to a dentist where we create a space maintainer, which is something that we're going to cement or place on the teeth so that it can keep the space open, so that the adult teeth, when they will erupt, it will actually assume the proper position. When we don't do that, sometimes your teeth start collapsing, they come too close to each other, and then when the teeth try to erupt, they don't have enough space, so they actually erupt whenever they can, wherever they can, or sometimes the teeth are stuck, and so they cannot really erupt, and so that can also cause teeth to be misaligned or crooked, as people know. And that would be the same thing when somebody is an adult and loses some teeth and the teeth are not replaced. Then either the teeth can collapse, taking that space, because teeth do move, they shift around, so that they will actually start like assuming some different position. Or, if the tooth is not replaced as well, you have some other teeth that would do what we call super erupt, meaning that, say for example, you have a tooth on the top and a tooth in the bottom, and now you're missing the tooth on top. So what's going to happen is the tooth in the bottom is going to start assuming the position or going up higher, and if it's an upper tooth, it's going to go lower. And what's going to happen is that actually it's going to super erupt, taking the space of that other tooth, and that's going to shift your bite and the position of your teeth. And what else, something else that can happen is that people are actually chewing with their front teeth. When you chew with your front teeth, you're putting too much pressure, because front teeth were never meant for chewing purposes. They were meant for either biting through your food, tearing your food, or tearing your food or biting through your food. So when you start using your front teeth in order to chew with them, and that happens with many people that are maybe missing a lot of back teeth, they start using the front teeth. That's really not good, because your teeth start, instead of being straight, they start flaring, and then it messes up your bite. So those are kind of like some of the things. It's not everything, obviously, but some of the things that can cause your teeth to assume the wrong position, or being misaligned, or being crooked, as we said. So things can definitely be done. You're not doomed if your teeth are not well aligned, or even if you have spaces that you want to close. We are definitely different. We have treatment to be able to cause your teeth to be more aligned, and that will be orthodontic treatment. And an orthodontic treatment is a treatment that's going to align your teeth, and there are different ways of doing them. You can either do it with braces, or also clear aligners, such as Invisalign, and that will help in realigning your teeth. So that's what I wanted to kind of like share with you today. As I said, I saw that there was somebody that asked me the question, and I thought, if someone asked me the question, then possibly there are many more people who are asking themselves the same question, and I thought it would be very great to actually answer the question on a video, so that you too can actually benefit from the information that I was able to share with the person. So if you have those kind of issues and you are around us, we can help you. We are Healing Wings Dental, and I am Dr. Valerie Mukanga. We are located at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. We can also be called, excuse me, at 972-213-0202. And also you can secure or request an appointment at www.healingwingsdental.com, and we will get back with you in a timely manner. Make sure that you can be seen. And that's what I wanted to share with you today. So if you found this information pertinent, please, if it was really enlightening for you, don't hesitate to share it with your friends, with your family, co-workers, whoever you know, so that they too can benefit from this information. And again, be blessed and have a very great day, and make it positive, because it is within your power. Bye-bye.